Welcome to the channel Nursing in Handy. This channel is preferably for the nursing fraternities to have a continuous learning in their profession. Today we will be seeing about the topic HIV AIDS in children. So HIV is considered as one of the social stigma in our society. So many of them does not speak about various treatment modalities and diagnostic tests regarding the HIV AIDS to the public society, and in the same way we should, as a nurses, we should also convey the education to the population that by which means the HIV AIDS is being transmitted and what are the ways it is not being transmitted. For example, the mere hugging, kissing and by the tears or saliva, the HIV AIDS does not spread to the other persons, but in our society still it is being considered as a social stigma. They don't even touch the children or the adult who are suffering with the AIDS syndrome. So before proceeding into the topic, we must know what is meant by HIV, what is meant by AIDS. So in our forthcoming slides, we will be seeing about what is meant by HIV, what is meant by AIDS, and what are the causes of HIV, what are the risk factors that causes the risk HIV in the children, and also the treatment for the HIV is a multidisciplinary approach, that is in a collaborative manner. We as nurses and the physicians and pharmacists, physiotherapists and rehabilitationists, like that, everyone join together and give the medications or treatment modalities to the children with the HIV. So we will see in detail about the HIV AIDS in children. Introduction. A clinical entity characterized by profound loss of immune function associated with the depletion of CD4 helper T lymphocytes, and it was recognized between the 1981 to 1985. It was renamed as acquired immune deficiency syndrome. It was found that this syndrome is caused by the infection with the human immunodeficiency virus. So this means that if a person is affected with the HIV, the CD4 cells, the CD4 helper T lymphocytes, mainly it has the affinity towards the CD4 cells and it causes the depletion of the CD4 cells. So when in a person's the CD4 cells gets depleted, that occurs, that HIV being changed into the AIDS, that is acquired. So this HIV is being acquired during the life of their time. That means it is not a congenital. And immunodeficiency, this virus is going to affect the immune system of the person and it is a group of disorder such as known as syndrome. So what is HIV? Human. H is for human, that is this virus can live only in the human. So outside of the body of the human it is not alive. So inside the human's body it is live. Immunodeficiency means this virus is inside the human body, it is going to affect the immune system of the person. And virus HIV is a retrovirus, that means a genetic material of retrovirus as carried out in the form of RNA rather than a DNA. So this genetic material is not carried out by the DNA, whereas it is being carried out by the RNA. So retrovirus usually contain an enzyme reverse transcriptase that helps in converting this RNA to DNA during the replication process. So this HIV virus that gets into the body of a person, that is the infected person, it is going to survive there by replicating that cells, by having the affinity towards the CD4 cells. So after having the affinity towards the CD4 cells, that is going to cause the cell death of the CD4 cells. So once the person is having the reduced CD4 count, so their immune functions, their immune system is being completely affected by this virus. So there this HIV will convert into the AIDS, that is acquired immunodeficiency syndrome. Next is understanding the immune system. So we must know the basic concept of how the immune system is. So lymphocytes are a type of white blood cells, that is WBC. So this WBC are very important for the part of the immune system. So macrophages act as a clearing cells. Neutrophils, it attacks the bacteria, and eosinophils that mediate the allergy. So only when we have allergy the eosinophil count gets elevated. So B lymphocytes makes the antibodies, And T lymphocytes, it coordinate the immune system's attack on the virus, fungi or some bacteria. So whenever we are being affected with the, for example, I am having the common cold or fever means, so when a virus gets into my body will have a defense mechanism by producing the running nose or fever in my body. So that's the main functions of the immune system. So the body protects itself from infection in two ways. One is the skin and mucous membrane. It prevents the physically entering of any infections into our body. And the same way, the immune system, it fights the infection inside the body by exhibiting some of the signs and symptoms like fever, common cold or running nose, like that. Next is, this immune system protects the body by recognizing and destroying. That means whenever a foreign body is being into our own body will fight against that foreign particles. So for example, infectious agents such as bacteria, virus or parasites, when it get into our body, immediately our body will act as a defense mechanism and produce some defense mechanism like signs and symptoms like common cold, fever, to fight against that virus and bacteria. So next is foreign objects. For example, anyone has underwent any transplantations or any pricking of any thorns. So immediately what happens when we have a pricking of thorns? We have a inflammation, we have a redness and we have a pain. So and the same way, the lymphocytes are present in lymphoid organs which are found throughout the body. They help to manufacture the WBCs, that is white blood cells, that protects our body. So T lymphocytes are processed and stored in the thymus. The most important T lymphocytes are CD4 type and CD8 type. So this HIV virus is especially attracted towards the CD4 type of lymphocytes. So only when this virus enters into our body, it is when it enters our body, it is being alive. It gets affinity towards the CD4 cells. That is, this genetic material is carried out by the RNA. The RNA contains a reverse transcriptase that converts into DNA. This DNA is going to affect the host DNA, and there they are going to reduce the CD4 count of the person. So next we will see about how does the HIV causes the AIDS. So first, the viral replication takes place, that is, the virus enters into the body of a person and there the replication takes place. Replication in the sense the duplication. Again, how to say, they will have a formation of other cells that will take about 8 to 10 years. So there it causes the CD4 cells to get dead. So further impairment of the immune system, that next it leads to the increased likelihood of opportunistic infections, and that causes the AIDS. So opportunistic infections like meningitis or any other infections, because they have immunocompromised persons, so they are very prone to get the infections. So how does HIV make us sick is, so constitutional syndrome. So patient can become sick from constitutional symptoms of HIV such as fever, night sweats, fatigue, rash without an opportunistic infection. So patient with HIV can die from opportunistic infections such as tuberculosis, pneumonia, herpes virus and meningitis, but HIV can also directly affect the organs of the body. That is going to cause, since the persons with HIV have the immunosuppressions, so they are more prone to get the opportunistic infection. So what are the opportunistic infections for the HIV? That is TB, pneumonia, meningitis. So the direct infection of the major organs that causes, when the HIV affects the direct organs like brain, it is known as HIV encephalopathy. Gut is HIV enteropathy. Kidney is HIV nephropathy, and heart is HIV cardiomyopathy. Next is how we can give a definition for the AIDS is, it is A for acquired, that is not born with. So it is not a congenital, so it is being transmitted from the persons to the persons. Next is immune system, that is the virus, it is going to affect the immune system of the person. That is, when a virus enters into the body, it is going to reduce the CD4 cells of the individual. That CD4 cells, when it is being decreased, it is going to cause the immunosuppression. So deficiency, that means not working, malfunctioning of the body's immune system. Next is syndrome. That means a persons with AIDS may experience a range of different diseases and opportunistic infections. So what are the opportunistic infections we have seen? Like meningitis, herpes, next is pneumonia, tuberculosis, like that. So when it is being acquired infections, it is going to affect the immune system of the person, and it is going to cause the deficiency of the immune system. That is, the person who is being affected with the HIV, they are going to have the immunosuppressions, and the same way it is considered as a syndrome. Syndrome means a group of signs and symptoms. So difference between HIV and AIDS. HIV is a virus and AIDS is a disease. HIV develops into AIDS. So AIDS is the end stage of HIV infection. So people with HIV infection may be asymptomatic but they can be functional. So we have seen the viral replication will take place, that is about 8 to 10 years. That 8 to 10 years they will be asymptomatic. They will not exhibit any symptoms of the HIV. Next, the people with AIDS have a severe infections and may not able to carry out the normal daily activities. So once there is a viral replication is being taking place, at that time sometimes the persons will be asymptomatic. So, but they can be functional. They will have a normal daily activities. So, when it is being changed into AIDS, they will not be able to do their normal day-to-day activity also. Next is HIV transmission. So, how and all it can be transmitted is by blood, semen, vaginal secretion, cerebrospinal fluids, synovial, pleural or pericardial or peritoneal fluids, amniotic fluid, breast milk and other body fluids visibly contaminated with the blood. So some of the fluids which is not considered as not at all considered as a risk is, one is tears, sweat, urine and feces, saliva. So until and unless these all the body fluids which contains the visible blood, it is not considered as risk as other fluids. Next is the amniotic fluid does not contain HIV unless there is an interruption in the integrity of the amniotic sac, that is the rupture of membrane, or when we are providing any invasive procedures like amniocentesis or trauma. In that cases what happens, there will be a rupture of the amniotic sac. So what happens, there will be a crossing of this HIV to the babies. Next is HIV has been found in saliva and tears and all. It is very low number and it is not going to make a much difference in the persons. And other ways of transmission of the HIV is like anal sex, vaginal sex or oral sex, or sharing the infected needles. So how we are sharing the infected needles, like injection of the drug. So when a person is having the drug addicted, if they are sharing their needles with each and everyone, so that infected needles will cause a HIV infection. Next is reusing of the infected instruments in the operation theatres, or receiving the infected blood or blood products and organs can allow the transmission of the HIV. Mothers can transmit the virus to their babies during the pregnancy, delivery or breastfeeding if they have not properly under the antiretroviral therapy regimen. If they have not followed the ART regimen during her pregnancy, that will cause the transmission of the HIV infections during the delivery. Next is how HIV is not being transmitted, like mere kissing or hugging, contact with the sweat, tears, urine or feces, insect bites, example mosquito or bed bugs, or bathing or swimming in the same pool or pond, sharing the cooking utensils, cups, toilet seats, bedding, telephones or towels, eating food prepared by an infected person. So these all are some of the reasons that the HIV is not at all transmitted. So we have to educate the public society regarding the transmission and non-transmission of the HIV infection. Since they are considered anyone with HIV, they are being isolated, they are being discriminated, they are not even get acquainted with them, they don't even talk with them, they think that even hugging and kissing causes the transmission of infection. So we as a nurses has to educate the community regarding this transmission of the HIV infection. Next is the biological factors affecting the HIV transmission is like high viral load, advanced diseases and presence of blood, semen or genital secretions during the contact. And the recipients are, so they are more prone like females, poor health, presence of sexually transmitted infections, exposure of the blood, semen or genital secretions, uncircumcised male, trauma during the sexual activity. So these all are the some of the biological factors that affects the HIV infection. Next is socio-economic factors like social mobility. So from urban to rural or rural to urban when they are been migrating, and gender, poverty. So cultural factors, stigma and denial, drug use and alcohol consumption, domestic and community violence. Next is home to refer for HIV testing. So these all are the persons we have to inculcate in the HIV testing. That is, if a person is having hepatitis B infection, hepatitis C infection, or sexually transmitted infections, tuberculosis, AIDS like illness, or all the pregnant women and infants born to HIV infected or high risk mothers, men who have sex with the men and partners, and bisexual partners, transgendered partners, people who have multiple sexual partners, injecting drug users and partners, and everyone. So AIDS like illness could include like candidiasis, central nervous system related infections, unexplained fever, unexplained diarrhea, unexplained weight loss. So those with recurrent upper respiratory tract infections and all. Next is prerequisites of HIV testing. So I will make other video regarding the detailed video regarding the diagnostic test of HIV testing. Due to the time concern, I'll just explain these all diagnostic tests in the next videos. So we will do the antibody based test like rapid test, ELISA, that is enzyme linked immunosorbent assay test. Next is antigen based test. Next is PCR test, that is polymerase chain reaction test. So these all are the tests we have to do it, and prerequisites is first we have to get the consent from the patient, then we have to maintain the confidentiality. Next is WHO clinical staging of HIV in children. Again, this clinical stage of HIV infection, I will detailedly put other video in detail. Due to the time concern, we will skip on the explanations. I will explain in detail in the next video regarding the clinical stagings. So clinical stage 2, that is unexplained persistent hepatosplenomegaly, popular pruritic eruption, extensive Wart virus infection, and extensive molluscum contagiosum, recurrent oral ulceration, fungal nail infection, lineal gingival erythema. Next, herpes zoster. If a person is affected with the chronic upper respiratory tract infections like otitis media, otorrhea, sinusitis and tonsillitis. Next is like clinical stage 3, that is unexplained moderate malnutrition, not adequately responding to standard therapy, unexplained persistent diarrhea, unexplained persistent fever, that is more than 1 month and longer, persistent oral candidiasis, that is up to first 6 to 8 weeks of life, oral hairy leukoplakia, pulmonary tuberculosis and everything. Next is clinical stage 4 is like again unexplained severe wasting, stunting or severe malnutrition. Their bones will be predominantly visible, so not responding to the standard therapy. Next is extrapulmonary tuberculosis, Kaposi's sarcoma, central nervous system toxoplasmosis after 1 month of life. Next is clinical stage 4, that is continued HIV encephalopathy, cytomegalovirus infection, chronic cryptosporidiosis. Next is chronic isosporiosis. Next is cerebral or B-cell non-Hodgkin's lymphoma. So, these all are some of the disease conditions or the staging. How in first stage, how in second stage, how in the third and fourth stage, how the persons will be. Next, the very important is management. So, aggressive antiretroviral therapy, that is ART therapy is being indicated for the children with HIV. Next is the normal CD4 count for children is for less than 12 months, the CD4 count should be more than 1500 cells per mm cube. So 1 to 5 years is CD4 count, that is more than 1000 cells per mm cube. Next, more than 6 years is CD4 count more than 550 cells per mm cube. So when the HIV enters into our body, that is going to affect this CD4 cells and going to reduce the count of CD4 cells. So recommended ART according to NACO for children is, under this national program, the CD4 count will be done to screen the medical eligibility of the ART. So before starting the antiretroviral therapy, they will screen the CD4 cells count. Next is NACO guidelines is less than 11 months respective of CD4 count ART to be given. So 12 to 35 months, so CD4 counts if it is less than 750 cells per mm cube, we have to start it. Next is 36 to 59 months, CD4 count less than 350 cells, follow the adult guidelines of ART. Next is more than 5 years, initiate the ART before the CD4 count drops below the 200 cells per mm3. So next is, these are the categories of the ART drug. So statuvudine, we have to give the nevirapine, or zidovudine, we have to give a efavirenz. Next is lamivudine, if age, years or weight is less than 10 kgs, so we have to give the nevirapine. So along with this antiretroviral therapy, we should also give the pneumocystis pneumonia prophylaxis, that has to be given to the infant in whom the infection is detected on the basis of positive viral test. So intravenous administration of the immunoglobulin in infected children should be given. So antifungal drugs such as nystatin, ketoconazole, fluconazole and clotrimazole may be given in cases of persistent or recurrent candidiasis. So next is nursing management. The caregiver should wear the gloves while changing the diaper. Good hand washing should be done before and after handling the babies, and barrier nursing should be done, that is usage of the personal protective equipment while performing with the care of the children. Next is the live vaccines should not be administered, and in the same way the intravenous gamma globulin every 1 to 4 weeks to provide immunity against some diseases. So we have to administer them for 1 to 4 weeks. You have to administer the IV gamma globulin. So next is, if the children is having lactose intolerance, so we have to provide a lactose free diet to the children with the recommended doses. So lactose intolerance means the lactose is being present in the breast milk or the milk. So that lactose is not being tolerated by the body of the baby. So what happens, whenever we are giving the feeding, they will projectively vomit it. So in order to prevent this, we have to provide, other than lactose, we have to provide a milk substitute. Next is, in children with oral lesions, we have to provide a cold liquids or a blend diet. Without any spices, we have to give the blend diet. Next is, we have to meet the nutritional requirement twice the age. That is, for example, they have to provide for that particular age, if we have to provide a 200 kilocalorie means we have to provide the double the kilocalorie, that is 400 kilocalories. Next is, skin care should be done, since the babies will have a persistent, depending upon the clinical staging of the HIV, if they are having the persistent diarrhea, the perianal area should be kept dry in order to prevent the skin excoriation and the infections. And the same way the children we have to provide a psychological or physical need. We have to provide a psychological counseling to the children regarding the ART therapy. Next is prevention of vertical transmission, that is from the mother to the children. How we can prevent is, so mother to child transmission can be reduced by administering a regimen of zidovudine to the mother and also to the newborn. So mother is given zidovudine 100 mg 5 times per day orally from 4th week of gestation till delivery. Next, at the end of the time of delivery, 2 mg per kg, that is IV. Zidovudine is given in the first hour of labor, followed by 1 mg per kg hour till delivery. So newborn is also given zidovudine 2 mg per kg every 6 hours till 6 weeks of life. That means till the 6 weeks of life, every 6 hours you have to provide a zidovudine of 2 mg per kg. So also it is been that in 1999 it is being proved that along with elective cesarean section, if we are providing the ART therapy, it is being found very beneficial. So prevention of horizontal transmission is like whenever we are administering any blood or blood products, we have to do proper screening of the blood products has to be done, and universal precaution should be carried out while carrying the newborn or the child. Next is post-exposure prophylaxis must be given. If as a occupational exposure if we have done means, we have to have a post-exposure prophylaxis as soon as possible. So when as a nurses, when we are handling with the patients with HIV and AIDS, we have to be very careful, and we have to use a double gloving method or universal precautions while carrying the babies with the HIV. So that's all about the HIV AIDS. So far we have discussed about what is meant by HIV, what is meant by AIDS, and how it is going to affect the immune system, in which count they are going to reduce, that is CD4 cells, what are the risk factors, what are the management we have seen. In management we have seen what are the medical management and nursing management. If a mother is taking the ART medications during her pregnancy and the delivery time, there is a very less chance of transmission of the vertical transmission, that is from the mother to the baby. So that's all about the content HIV AIDS in the children. If you have any doubt, kindly drop down in the comment box. Kindly like it, share it and subscribe it, and thank you for watching.